Hello everyone. I'm sharing with you an interesting case of painless HSG in a case of endometriosis with adenomyosis. So the patient had come for HSG to check the patency of the tubes, and here I'm sharing the video of the HSG, and here you can see the video. Evidence the case of painless HSG in which here you can see the uterus is deviated towards the right and is indented on the left lateral wall. There is a little intravasation of the contrast. The right tube is well seen, free spill is seen. However, on the left side, you can see that the tube is seen, but the contrast is getting accumulated into a loculated area with a septa within. We continued to put in more contrast, and as we could see, the cyst continued to grow in the size. So here, we have injected almost the entire contrast and the saline. The right tube, both the tubes have disappeared, but the loculated contrast is persisting. So we decided to do a ultrasound for the same patient. And here you can see that on the ultrasound, you could see a big cyst on the left side, which had the contrast within. These echogenic specks are the contrast within. And also seen is a septa within the cyst, which coincided with the HSG findings. And here you can see that this is the uterus, this is the contrast in the endometrial cavity, and the posterior myometrial wall is bulky, which is displacing the endometrium towards the right, which was seen on the HSG also. So again, you could see the big cyst with the communicating cyst, smaller cyst within, and here's the contrast within the cyst. The additional finding which we could see was that the left tube was dilated here, which was not very clear on the HSG. And on repeat, and then on reviewing the HSG again, here you can see that the left tube is seen to be dilated here. If a collaborative ultrasound would have not been done, we could have missed this dilated tube in the HSG. So if both the things are done together, the efficacy of the report definitely enhances. Thank you for watching.